listening to the best of the Martha Zoller Show. To hear the full show each day, tune in to AM 550 and FM 102.9 WDUN or log in to accesswdun.com and click the Listen Live button from 9 to 11 Monday through Friday. In our continuing series of kind of letting people know what services are out there and what departments do in the state of Georgia, we've got Kevin Tanner with us. He is the commissioner of the Georgia Department of Behavioral Health and Developmental Disabilities, but he's also a local guy. He represented us in State House 9 for a couple of years. He ran for the 9th District congressional seat, which he and I have in common. We both lost that run, right, Kevin?
That's right.
And he's also a longtime resident in this area, probably the longest I've ever known. And his family has been here for multiple generations. So we welcome you back, Kevin Tanner. How are you?
I'm doing well. It's great to be with you, Martha.
So just to start off with, tell people what is the Georgia Department of Behavioral Health and Developmental Disabilities.
Yeah, thank you. So we have multiple hats in the state. We serve as a state mental health authority, which includes running our state mental health hospitals and also helping manage our crisis centers around the state. We also are the Developmental Disability Authority for the state, so we oversee the now comp Medicaid waivers for individuals with developmental disabilities. And then we also do the addictive disease. We're the Addictive Disease Authority for the state on substance abuse. And then we also are suicide prevention. So our agency has just over 4,500 employees around Georgia with a budget of $1.6 billion. So we have a lot of great folks out all across the state of Georgia doing really good work.
So how long have you been in this position?
2.5 years.
And this was an offshoot, really, of the David Ralston bill, House Bill 1013, which is a little bit of a play on, what the emergency call is, right, for law enforcement, that when you have a mental health problem, it's called a 1013 call. Was that done on purpose, do you know?
If it was, they never have told us. I spent 8 years in the General Assembly.
I knew that, yeah.
And we were out. I was not in the General Assembly when we wrote House Bill 1013, but I was chairing the Behavioral Health Reform and Innovation Commission. Yeah,
I think it's so important that we're doing this work. So let's just talk about each of these areas first, and then we'll get into, kind of questions about what y'all do. So mental health hospitals, I think that's some of the most misunderstood information in the state of Georgia. People don't know what they are, where they are, or how they can access them.
Yeah, so the state, our agency serves as a safety net. So we're there for individuals who don't have health insurance, those individuals who are underinsured, or the individuals who have come in contact with the criminal justice system and been ordered to us because of a crime to come to us for services. We have 5 hospitals across Georgia. We have one on Panthersville Road in Atlanta. We have one over in Augusta. We have one down in Milledgeville, the old Central State Hospital campus. We still have 2 buildings there with patients. And then we have one in Columbus and one in Savannah. So we operate those. About 80% of our employees in our agency work in one of those hospitals. And we serve a lot of individuals every year. And our hospitals are completely full every single day.
And how is staffing impacted by that? Because we were talking a little bit before we got in here about COVID, but I don't want to blame everything on COVID, but I think there's staffing issues in healthcare. I mean, the only sector of businesses throughout all of COVID that was increasing every month was healthcare businesses. So I'm sure you had the same kind of problem.
Yeah, and I know, Martha, you know this all too well, being married to a doc, that health care during COVID was just so competitive. Our agency lost over 1,200 individuals during COVID because traveling nurses were making so much money, and they left our agency. And it took, when I came in, we were still feeling the effects of that. So thanks to the governor and the General Assembly, they've done 2 pretty major pay packages for state employees, including our agency. And then we've been able to save money internally and give our doctors raises to bring them up to market rates. So we've been able to stop the bleeding and to build back most of that staff. And we're in a good place because I think it was March of last year was the first time since COVID started that our hospitals didn't have any beds offline because of staffing. So we've been able to make those gains back. And We're continuing to fight that fight. I was down at Georgia Southern with the president last week talking about how do we increase the number of psychologists coming out of PhD programs. We're partnering with colleges and Chattahoochee Tech to create an LPN program in high school with the Marietta City Schools. So we're always trying to find ways, how do we increase the number of people going into this field?
Yeah, I agree with that 100%. I mean, I know a number of people that are in the healthcare business now that are transferring what they're doing into a mental health field, whether it's a mental health PA or it's a mental health nurse practitioner or it's a mental health nurse, whatever it is. So I'm excited to hear that. Now let's talk about disabilities for a minute. So what is it in the disability world that you all handle?
Yeah, so individuals who have developmental disabilities who get on what we call the planning list for a now comp waiver. So that may be someone who needs some in-home supports. Their family needs in-home supports to help take care of maybe an individual in the home. But it can also be that they need full support, so they need to live in a host home with 3 other individuals, and all of that flows through our agency. Now, one of the biggest challenges, and one of the things when I came into this role, and really even before getting this job as the chair of the Behavioral Health Commission, is we wanted to start looking at not just symptoms of problems, because I told our agency we're really good firefighters. I can put out fires when they happen. But we got to get to what's causing the fire initially, and so in the developmental disability space, we had on average about 30 individuals stuck in emergency rooms every day, waiting on a bed somewhere, and a lot of those individuals had developmental disabilities plus a medical condition or plus a mental health condition, and we didn't have a place. So thanks again to the Governor and General Assembly, we're building right now, and it's going to open in May, the first developmental disability crisis stabilization center in the state and really in the country. It's going to be 16 inpatient beds, and it will directly remove those folks out of a hospital and get them into a place that the docs there really know how to treat them. But what I'm really excited about is Mercer Medical School is going to run the outpatient component. So we're going to have the most robust outpatient component in the country, training new doctors, teaching these doctors that are going to go all over Georgia and work how to treat this population. We also built 2 new homes, or opened up 2 new pilot homes in the Augusta area. So we've cut that number down to less than 20 now in the hospital. Within the next 2 years, my prediction is there'll be no one stuck in a hospital waiting on a bed because of a developmental disability.
Oh, that's great to hear. That's really good to hear. Now, you also mentioned substance abuse and suicide. So just kind of give us an overview of that, and then we'll get into some more serious questions. Yeah,
so we have a lady, Rachel Holloman, does a great job running our suicide prevention side of the house. They were just at the University of Georgia this weekend with 800 students. They do a whole lot of events around suicide prevention. As you know, suicides among young people have increased in this country. And I have 3 daughters, and just the stress that people have to go through now growing up. So it is a challenging time, but we also do the addictive disease work. The other hat that I wear is I'm the trustee of the Opioid Abatement Settlement Fund. So that's $638 million that's going to flow to Georgia over the next 18 years. And we just actually signed the contracts on the first rounds of grants, $50 million. And the second round of grants will open up in May. So I encourage your listeners, if you're in that space, and it can be a nonprofit, it can be a government entity, it can also be a for-profit, but gaopioidtrust.org is the website. The second round of grants will open up this May.
And that's to fight opioid addiction? That's what this money is for?
It is. It has 5 buckets, but it is to prevent it from occurring. It's to research. So we fund a lot of our universities doing research in the area. It's treatment for someone who's addicted. It's about recovery, helping people stay in recovery, and it's also about harm reduction. So any of those 5 buckets, the trust funds.
So I'm going to ask a stupid question here. Is fentanyl in the opioid world?
It is.
Okay. I wasn't sure if it was or it wasn't. And so that's huge right now.
It is. We saw such a tremendous increase in Georgia and overdose deaths from fentanyl specifically. That's right.
And I call it poisoning. fentanyl poisoning. Mm-hmm. It's terrible. We got a question from a listener. Jean said, please ask Mr. Tanner how they're handling gambling addiction, or if they are, because it's slated to be the next opioid crisis.
Yeah, so we are not specifically tasked with specifically gambling addiction. I will tell you, oftentimes what we find, though, is individuals who have addiction have more than one. Gambling may be one addiction, but they also may have an alcohol addiction or a substance abuse addiction. And so we try to treat the whole person, and we also meet people where they are. So a lot of times we come in contact with individuals who may present in one way, but when we really get to the core issues of the problem, there's other things happening.
So I know you're a very methodical person. I've known you a long time. And so I'm sure you have a long-term plan with this because, I know that sometimes we look at the accomplishments you've made and we've gone, well, the problem is so much bigger than this. You're adding 15 beds, but you got 30 people every day. Do you know what I mean? And so what is your long-term plan? Or do you sit and worry about a long-term plan?
No, we do. We try to be very strategic, and I think being methodical is what's important because we got to continue to put fires out as they're occurring every day. But we've also got to look down the road long term to say we want to make sure we're in a better place. And I think that on the mental health space, for instance, one of the first things I did is I said, I've got to have a good understanding of how many crisis beds do I need? How many inpatient beds do I need? And we did, so we brought in an outside national group that really has expertise in this area, and we looked at what's our crisis bed count, and how many do we need in Georgia, and where do they need to be located? They identified we need 8 additional crisis centers across Georgia by 2032, and they told us where they needed to be to meet the demand. How many inpatient beds do we need? We need 232 additional forensic inpatient beds immediately, and those obviously could be anywhere in the state. So we're developing out a strategic plan to take us over the next several years that's thought out in a methodical plan and it's not inexpensive, unfortunately, because the state, back when they closed a lot of the hospitals down, they used those dollars to build up a community network, which is great because most people can be served in the community, but there are some people who do need that inpatient bed.
So, Kevin, I have a question. How does someone begin to reach out to you to begin the process, number one? And number two, could you please explain the phone number 988? Because this is new information to me.
Yeah, that's a great question, and it's been new information to a lot of Georgians, I'll say that. We did a survey in 2023. So Georgia was a little bit ahead of a lot of the country as we had a GCAL, which was a 1-800 number where you could reach out. It's a suicide prevention hotline. But the federal government in 22 stood up the 988 line, which is a national number. In Georgia, we operate the 988 system. That is a 3-digit number you can call 24 hours a day, 7 days a week. You can also, and I like to say this because if you're like me and you have younger children or grandchildren, my daughters don't like to talk on the phone. They text or chat, and you can do that with 988 also. But you can call 988 to talk to a licensed live clinician 24 hours a day, 7 days a week. And that can be anything from my son has been diagnosed with schizophrenia and my son's off his medication and my son needs some help. Or it could be I'm feeling depressed. I'm having trouble finding a licensed clinician in my area. Can you help me? Whatever the case is. The other great thing about 988, let me say this, we receive over 20,000 calls a month currently in the 988 system. We can also dispatch mobile crisis teams. That's a 2-person team that can go anywhere in the state, and we like to say we meet people where they are. So if your son has that diagnosis and your son's off the medication and needs some assistance, we can dispatch a team to your house, and they can work with your son there in place. So it's a great service. And back to your point about not hearing about it before, only 16% of Georgians in 2023 had heard about 988. Now the number in the latest poll was it's just under 85% has now heard of 988. And
may not know what it is, but they've heard of it.
Yeah,
Okay.
a little over 40% actually knew exactly what it was.
Okay.
And that's because we've done a very concentrated marketing effort. There's been some federal dollars flow through SAMHSA to us at the state to be able to market 988, and I think we've done a good job getting the word out.
You know, I think I would have fallen in, Joni, that I probably knew there was such a number as that, but I didn't know what it was.
Right.
I mean, I didn't know what it was, and I didn't know where you would start. Joni asked me this question before you got here, and I said, well, I guess you'd call 911, that most people start with law enforcement with this. Is that probably true?
That happens a lot, and I will tell you one of the reasons, and when we were talking at the break and you talked about stigma, one of the challenges for families to reach out is they don't want to call 911 because they don't want to involve law enforcement. They don't want that stigma. That's the great thing about 988. When we send a mobile crisis team, this is not someone coming with blue lights and siren. This is a clinician coming that's trained to deal with that. So we try to promote 988 to get folks to call 988. But the other thing we have done is we built really strong relationships with the 988 or the 911 centers across Georgia, and we're training them to understand this is really not a police call or a fire call. This is a mental health call. So they do a warm handoff to the 988 call center. And our 988 folks are trained too. If someone calls and they need a police presence there on scene, they're connecting them.
You can join us on the phones with questions at 770-535-2911. You can also text us at that number. And right now we've got a call. We've got a question from Mary in Gainesville. Hey, Mary, how you doing?
I'm good. Thanks for taking my call. I just wanted to comment. I'm a licensed marriage and family therapist, and today's the first time I've heard of the 988 number, so I was surprised about that. Also, I would love to see the general public educated on why you go to a mental hospital, and correct me if I'm wrong, Mr. Tanner, but it's so that they can see a psychiatrist the same day if they're suicidal or homicidal for their safety. But it's usually fear that's driving most families, I think, to try to put their family member in a mental hospital because they don't know that's the point. And then the last thing I would comment on is I worked at Laurelwood Intake there at Northeast Georgia, and when middle schoolers would come and they made a comment that they wanted to kill themselves, and then we had to, admit the child, and the parents were so outraged because they didn't know their child was going to be sent miles away to a mental hospital just because they'd made that statement. So if you could answer or comment on those, I'd appreciate it.
Yeah, so, number one, I'm glad you were listening to the Martha Show today to learn about 988, and any help you can give us at spreading that message around your profession would be great because we value our family and marriage counselors across Georgia. And you're right. So we have what we call behavioral health crisis centers across Georgia. You have one here in Gainesville with Avita. That is a 24-hour receiving facility. So we have what we call the living room model, where if you're not feeling well, you're depressed, maybe you need some medication, you can just walk in and receive treatment at that center. And they have advanced practice psychiatric nurses on staff. They have psychiatrists on staff, doctors, et cetera. So we have those spread out all across Georgia. And you're fortunate here in the Gainesville area to have one of the better ones across the state right here that Cindy Levi runs. So that's there. Our mental health hospitals themselves are for people who need a longer stay. Typically, the crisis center is anywhere, if it's an inpatient stay, 3 to 7 days. Typically, rarely would it go over the 7 days. But sometimes we find that people need a longer stay. As far as children go, that's been a big renewed focus here in Georgia. And I think a lot of that has to do with what happened over in the Winder area, and a lot of people are just concerned. We have a few child and adolescent crisis centers in Georgia. We're building a new one right now in Macon that are specifically designed for children. But the other thing I'll say is most children have health insurance in Georgia. Almost every child has some type of health insurance. And under parity, which House Bill 1013 enforces parity here in Georgia, there's insurance companies are supposed to provide whatever level of treatment that's needed. Now, that doesn't mean they always do that, and we know that, but we're continuing to try to improve that system.
So how big of a problem is it, what insurance involvement? I don't want you to pick on insurance companies. I'm not asking you to do that. But I think a lot of people don't know what kind of coverage they have for this kind of stuff until they engage with it, because it's not something they're planning like you would. Like when I signed up for my insurance plan, they asked me what drugs I was taking and what was my history and what I expected to happen. Like, was I getting my knee replaced or whatever it is? But I don't think anybody really says, well, I'm going to have a mental breakdown at some time in the next couple of years. Does this cover that? Is that a big problem for you or for Georgians?
It is. And going back several presidential administrations ago, the federal parity law was signed into place. It requires insurance companies to provide the same level of treatment for mental illness that they do for physical health. The challenge, though, is they left it up to the states to enforce it. So even though it's the law, it had to be enforced. House Bill 1013 started setting up the ability to have that enforced. The problem, though, is most individuals, if they go to the doctor, they don't know that there's a parity violation. They just know the insurance companies turned them down. But if it's a mental illness, if you have private health insurance, there's a portal that you can go to at the Georgia Insurance Commissioner's office to file a complaint. If it's Medicaid, you can go to DCH to file a complaint. One of the things that we've learned, though, through the Behavioral Health Reform and Innovation Commission, Dr. Brenda Fitzgerald chairs our Access Subcommittee. She heard a lot of testimony from Children's Healthcare of Atlanta, from Hillside, and from others that they had hundreds of documented parity violations, but they haven't been reported. So there is legislation that Speaker Burns has been championing. It passed the House. I think it's over in the Senate now, that would require, if a provider knew there was a violation, then they would have to report it, because over time we're going to change behavior and we're going to improve the system, but it's going to require those violations are reported to the proper authorities.
Yeah, Representative Katie Dempsey was on last week, and she was talking about the parity issue, and I think that's one of the real challenges, isn't it? Because obviously, first of all, a lot of providers don't know they're not. I mean, the doctor doesn't really know anything about payments, if you want to know the truth. They just do what they're doing for the patient, and they don't know whether insurance pays for it or not. And I think a lot of times the billing offices don't know why things are turned down either. I mean, and you get this voluminous paper about why something was turned down, but I bet most people don't read it. So you've got to know to go and file a claim.
Yeah, that's right. And Donna Highland, for instance, who's the CEO of Children's Healthcare in Atlanta, she serves on our Access Subcommittee, and they presented testimony. I think it was around 450 documented violations of parity they had, but they spend a lot of money tracking that down at Children's Healthcare. They've got Dr. Constantino, who's doing a great job there at Children's Healthcare. And you talked about a strategic plan. All of this is part of that strategic plan. Is we've got to get the insurance companies to provide the correct level of care to individuals. But we've also have to start looking at trauma-informed care. And Dr. Constantino and Children's is doing that with their big endowment, where they're focused on when this trauma occurs in a child's life, they're this much more likely to develop this, or this much more likely to attempt suicide, this much more likely to go to jail, this much more likely to develop mental illness. So they're intervening right then in that child's life. And part of that is tracking whether the insurance company is providing the correct level of care. So by requiring the providers do the reporting, if they know, like Children's knows, then we will be able to hopefully change behavior.
I have a question, Kevin. I believe in watching your child like a hawk. I want to know what they're doing, what they're watching, where they're going, who their friends are. There have been so many warnings. I know we've had mass shootings occur. The warnings have been out there. What can you say to that?
Yeah, so one of the things, and I know Martha knows him well, but Will Schofield here in Hall County, the Hall County School Superintendent, they've done tremendous work in changing the school climate and training every professional in the school, the bus drivers, the janitors, to be able to understand, because every child needs a trusted adult that they can talk to when they're depressed, when something's going on in their lives. Hall County has reduced the need to have a higher level mental health group because of that work they're doing in Hall County. And Will has been chairing a work group that we have at the state called it's school-based mental health, and they've got a group of experts, mental health experts, law enforcement experts, school superintendents, really looking at how do we identify earlier and how do we intervene earlier in that child's life to make sure they get the treatment, the help they need.
Well, and what's so beautiful about that program is that he acknowledges what we all know, is that the child that the school shooters are known to, they're not some random person that's come in off the street that nobody knows who they are, whether it's an employee or a child or whatever. And what's also interesting is that overall in Hall County schools, they have reduced the overall level of interactions between employees and students and all of that kind of stuff because they do a better job at handling it. And I love this program because it gets it at the source as opposed to waiting until something bad has happened.
Yeah, I try to raise up what Hall County's done every chance I get, because you're exactly right. We have 3 levels of treatment that we call it in schools, level 1, 2, and 3, with 1 being for all kids in this, or level 3 being that it's like a pyramid. Everybody gets it, and that's what's happened in Hall County. They've received that training, that education, and then you have group settings where you try to identify those at-risk groups, and the highest level is that individual counseling session. And Hall County's been able to reduce the need for that individual level care because they've done such a good job with the other 2 levels.
You know, Kevin, I've known you a long time, and what I love about you the most is that you're the same no matter where you see you. I mean, when you're on the air, off the air, when I bump into you on the square, wherever it is, you're the same guy all the time. And I think you need that kind of personality to do what you're doing. Does it ever get overwhelming because there's a lot on your plate? There's really a lot on your plate here, but I know you got a great team, but does it ever get overwhelming?
You know, people ask me sometimes in a different way. They're like, do you ever get tired of running into everybody you know at the grocery store? And this month's actually 35 years for me that I've been in some form of public service, from law enforcement to county management to state legislator to this. So I don't know that I know any way else to live other than under constant kind of stress. But I do tell the story, and I'll tell you that it can get overwhelming, especially in the office in Atlanta, especially during session. And when I get to feeling that way, all I've got to do is go out to one of our 5 state hospitals, and I run into somebody who is out in the yard. And I'll tell you this real quick. There was a lady that was in a poetry contest we were having at one of our hospital campus. She was reading her poem about her recovery journey. And it had been about 6 months prior to that they had to close an entire wing of a unit down because she was so violent. And it took 4 to 1 staff to control her. But now she was in a place where she was in recovery. And our staff performs miracles every day within the hospital setting. And when I go see that, it gives me a renewed energy that there is hope. And what I have found with a lot of families is they've just lost hope. And when we were able to restore that to them, it's a game changer. So it is overwhelming. I do get frustrated sometimes with people who maybe don't take time to really understand the system. They don't take time to there may be in a decision-making position and they haven't taken time to come visit one of our facilities, our hospitals, because we do have a lot of miracle workers. I'm very proud to be able to lead that organization.
So we have a question from a listener that said, is opioid addiction a mental illness? I've tried to be kind to a neighbor, and I think he needs a mental health facility.
So opioid addiction is not a mental illness. It's obviously an addiction. But it's a disease. It's a disease. You know, sometimes people's brains are just wired differently, and we're all. But I will tell you, opioids is one of the most addictive medications or drugs you can take, both legal and illegal. And almost everyone gets addicted to them if they take them long enough. And sometimes it requires, and a lot of times requires intervention. It may require medication-assisted treatment. But it is a disease. But I will tell you, I know a lot of people through the Georgia Council on Recovery who are living in recovery. And recovery is real in Georgia. People do and recover every day. But it is an addiction. It is a disease, and it can be very challenging without the proper help to be able to break that addiction cycle.
Yeah, I think it's going to be, I think the work you're doing is amazing. And I think the biggest thing we accomplished here today is that 988 number.
100%.
Because I got to tell you, I'm pretty plugged in.
Yes.
And I didn't know about it. And that makes me feel like, okay, well, how could I have missed something like that? So I think that one of the biggest things here is how can you first interact? That was the first question you had,
Yes.
Joni. How would somebody, because for many of us, we don't deal with this on a regular basis. And you've got someone and I'll tell you how it goes, because I've talked openly about, we've dealt with this in my family. In the beginning, you think, oh, I must be reading this wrong, right? Oh, this isn't that big of a problem. Oh, he's just had a bad day. Oh, in the beginning, you want to think that it's not anything permanent and they're just having a bad day or whatever it is. And then you start to think, this person needs help. Am I afraid of this person? And I think that that's not uncomfortable. And while I don't want to overly suggest mental health problems, because I think there's some people that are suggestible to things and they're taking up services of people that really need help. But at the same time, families need a little bit of help here too, because I think they're afraid in the beginning or they just don't know.
Right. Yeah. And I'll say that, there's the overwhelming majority of people who have mental illness never interact with law enforcement, and they never even interact with us. They work with their doctor, they work with their clinician, their psychiatrist, and they get on medication or they get in treatment, and they do very well. But going back to your question about how to access services, I will tell you 988 is a great entry point into the system. I like to tell people that, you remember the old Staples commercial where it was the easy button you could mash? That's what we're trying to design, is the easy button.
Like the Diet Coke button for President Trump?
That's right.
Right, yeah.
You just press the button, call 988, and enter the system so they can help you get into the system. Now, let me say this. It's not going to be perfect every time, because I hear stories about, somebody called 988 and they wasn't able to get the help they did. I've been was in law enforcement for a long time. It took a long time to stand up the country's 911 system, and it's going to take time to do that with a 988 system.
So then let me ask the next question, which is the logical question, I think, here. If somebody calls 988 and doesn't really get the outcome that they want, what's their next step?
Well, it depends. If you live here in the Gainesville area, I will tell you that Avita is a great resource. You have a 24-hour walk-in center that you can interact with. But I will also just remind people that really is the safety net system. So technically, if you have health insurance, you're supposed to go through your health insurance provider to find a doctor, a psychiatrist that takes your insurance. Now, one of our challenges is we have such a shortage of providers in this state.
Well, and I would say to people, this is my soapbox moment, which I say to people all the time. Everybody should have a primary care doctor. Okay, because the best way to get treatment is for someone to have a good history on you. And that's why you need a primary care doctor. I know there are people out there that don't have insurance, and we have been lied to by the media that you can't see the doctor if you don't have insurance. We have great clinics in almost every county where you can get primary care. You don't have to have insurance. And I know from my husband's experience that if you just told us up front you didn't have insurance, we figured out a way to see you. We don't want you to go without care, okay? So ask questions, get involved in your community. Don't just look on your phone for the answers, but figure it out. I think it's exciting. Kevin Tanner, thank you so much for your time today. I think 988, we opened that door.
Great. Thanks for having me.
It's where North Georgia comes to talk. It's the Martha Zoller Show on AM 550 and FM 102.9 WDUN.
You know, I'm a huge Ruthless Podcast fan. The funny thing is I knew most of those guys when they were interns, and now I feel like I'm their mother. But they do a great job on the Ruthless Podcast. And yesterday they had on Alex Isenstadt, who has written the new book called Revenge, the Inside Story of Trump's Return to Power. And so I connected with him on X, of course, and I got him on this morning. Alex, welcome to the program. How are you?
Hey, thanks for having me. Excited to be here.
Yeah. So, first of all, you're currently with Axios, right? And you were with Politico.
Correct.
That's great. And I think this is such an exciting concept because I look at Donald Trump because I'm not the biggest Trumper in the world. I voted for Nikki Haley in the primary. I am happy that he won, and I can look at this win as being something historic. And Donald Trump is a character that kind of sits by himself. Everybody wants to compare him to other presidents. There are no comparison. And I kind of put Ronald Reagan in that category. I kind of put Franklin Roosevelt. If you think back to Franklin Roosevelt in 1933, that's where the whole phrase first 100 days came from. He was doing things so fast. But of course, since everything was in writing, it went slower than what Trump was able to do. But he got a lot of court challenges, and he had a lot of things that were held up in the Supreme Court. So you have these larger-than-life figures that don't fit in with the traditional presidents, and I think Donald Trump probably is at the top of that list.
Yeah, absolutely. And one of the things I try to convey in this book is how the fact that he is not the traditional president made him appeal to a lot of voters, people who wanted something different, who saw him as a vessel for their frustrations against people in Washington and Hollywood and New York. And what he has come to symbolize to people is something more than that of a traditional politician, and that's really at the heart of his appeal in a lot of respects.
So you approach the campaign or people in his circle and say, hey, I'd like to follow this campaign. Obviously, you had no idea it was going to end up the way it did, but tell us a little bit about that process.
Sure. So I started reporting this book in February 2023, which is a couple months after Trump had entered the race. And I knew that this was going to be an interesting race. I think we all did. We all thought it would be dramatic and interesting. And so I thought there would be a story here. So what I did was I went to people in Trump world, around Trump world, people who talked to him, donors, allies, members of Congress, and I said, look, I'd really love to talk to you just to get a sense of what happens day to day, what your conversations with him are like, what happens on the campaign. And if you could just treat me like a journal and just give me a download every day or every week of what happens. And some people said yes, and some people said they wouldn't want to participate. But we made the deal that the information that they gave me would come out once the campaign was over. And so what I tried to do was just create sort of a fly-on-the-wall dynamic where people felt like they're there, they could see the campaign in real time and feel sort of like it's a movie. And so I didn't try to write this as a pro-Trump book or an anti-Trump book, but really just the goal of making readers feel like they're there and they can experience it firsthand.
And one of the things that Alex does so well, listeners, is that he does cover all sides of issues. You're really an old school journalist. I mean, you cover the stories, you don't take sides, and that's what I love about your work. So thank you.
Thank you so much.
Yeah.
I appreciate that. Thank you.
Did you get to talk to President Trump at all?
I interviewed him early. It was earlier in the campaign. It was in June of 2023. He had just been indicted, and he invited me onto his plane. I had a couple conversations with him on his plane that day. So
I love Susie Wiles. Okay, she is like, she doesn't get any of the credit I think she should get because, you know, in the mainstream media would have been all over the first woman chief of staff, but I don't think there's been a story written on that. And I love her because she came out, she's Pat Summerall's daughter, and I'm a huge college football fan, and I think that she probably learned a lot about competition and how to do things from living in a household like that. How big is she, along with Chris, in making this happen?
She's a massive figure in making this happen. She, for the first time, gave Trump a really functional operation, a campaign that worked. You know, one of the things I write is that in 2016, Trump had a very chaotic campaign, and won in despite of the fact that he had a very chaotic campaign, right? He was doing it for the first time. And then in 2020, he also had a very chaotic, disorganized campaign. And I think when he was in the White House for the first time, it was fairly chaotic. I think we can all agree. Susie Wiles for the first time and Chris Losavita gave Trump a very functional operation, a campaign that ran smoothly, that was effective, that was probably even more effective than the Democratic campaigns of Joe Biden and Kamala Harris. I mean, it was that organized. And she has taken that, that same mode of, she is someone who she doesn't tolerate chaos, she doesn't tolerate drama, and she's taken that and she's taken it to the White House with her. And that's not to say there hasn't been some turmoil in this White House. All White Houses have them. But it has been a far more smooth-running operation and a far more drama-free operation than the first Trump White House that he had.
Yeah, no doubt about that. And I think she's done a fantastic job. I think that I had one person that I knew in the campaign that said they let Trump be Trump and then they control everything else. That was how they described it.
I think that's 100% accurate. I think that's 100% accurate. And they try to get rid of the things that they know will get him off track, but they don't do it in a way that cuts back at what he wants to do. They're there to help sort of smooth the way for him to accomplish what he wants while getting rid of some of the distractions that could get in the way of that.
Now, you in this book, and since I heard the interview yesterday, I've just ordered the book. I have not read the book, but after I read the book, we're going to have you on again. But you told some great stories about Butler, because that was really the turning point. And even though that was before we knew Biden was going to get out, the way that day unfolded kind of had it was kind of the umbrella over the rest of the campaign.
Absolutely. And there's so much that was untold about what happened in Butler. And so I tried to tell the story of what do we not know that happened that day. And one of the things I found was there was so much uncertainty about what in the minutes after he was shot. Susan Wiles, Chris LaCivita didn't know what was going on. They didn't know if he was going to survive. They didn't have a clear sense of things. And then you get to the Butler Hospital, and it was just mayhem, people trying to get their bearings. But what I also tried to paint the picture of is Trump is a guy who has this innate understanding of visuals and an innate understanding of how images work in pop culture. We forget that he was on The Apprentice, right? He's a creature of television. And he knew that those pictures of him holding up his fist were going to be powerful images that would stand the test of the campaign and would also help to shape his legacy. And so there's a scene in the book where he talks about when he's handed these photos for the first time. This was a couple hours after the shooting. He's sitting there in his hospital room, and someone shows him the pictures, and he says, that's the most iconic and the most American photo I've ever seen. And so he knew the power of that image and the impact it would have on the campaign.
Yeah, I think that's the most amazing thing. First of all, he wasn't hit that badly if he could think that way. I mean, and that was thankful for that.
Right.
But also it was very serious. I mean, just like he said, if his head had been turned a different way or gone a different way, it would have been a whole different outcome.
Absolutely. And he's well aware of that. He was very understandably so. He was shaken emotionally, probably a little bit more than he lets on publicly. And there's a scene in the book where the next morning after the shooting, he's talking to a former aide, and he tells the aide, if that bullet had gone a hair closer, my head would have exploded like a watermelon on live television. And he said in a way that made it clear he was pretty shaken by it. And so privately, he does talk about that.
Now, you talk a lot in the book about the Iranian threats also, that it's a real thing. A lot of people don't think it's a real thing. It's a real thing that the Iranian government has been trying to kill him.
Yep. Yeah, and one of the things that I talk about in the book was that the threat of Iran trying to kill Trump was far more deep and far more profound than we knew at the time. There was a scene where Trump decides to take a decoy plane, a Gulfstream G6 jet that is owned by one of his donor friends, and he takes the jet while the rest of his team is on Trump Force One, which of course has the highly recognizable lettering on it, Trump lettering on it. And the reason they did that was because there was a fear that the Iranians had teams of agents within the United States with access to surface-to-air missiles that could be used to shoot down Trump Force One either upon takeoff or landing. And so that was how real things were. And then there were aides who were told when they were climbing up the stairs to the plane, be sure to duck when you're getting inside the plane because someone might be out there with a rifle. And so it was that real. The threat of Iran was something that Trump was very much aware of, was very much concerned about. He started to ask about staging of events and where he would be on stage. And it was something that was a real concern throughout the final months of this campaign.
So he delivers the biggest win we've seen in a long time. Most every county in America moved a little to the right. The ruthless guys have these hysterical napkins that they sold at Christmas where one says Merry Christmas with the United States with all the red counties, and the other one says Happy Holidays with the blue counties. And it was funny, and I have a mixed family as far as political ideology. So I was able to give those napkins to all my kids, and they laughed. Okay, so it was a good thing for us to do since, they say mixed marriages can work. Well, mixed family political ideas can work too. So it was kind of crazy. But fast forward to today, and of course, we got this thing going on with Signal, and I looked at what was released this morning. It didn't look like war plans to me, but I'm not in the middle of this. But I know they were using Signal in the last administration for some chats. I knew people who were using Signal for that. What do you think? How big is this, and what do you see?
Yeah, it's hard to tell in Trump world whether a story is long-lasting or whether it only, whether it flames out within a couple of days. I think that, it raises questions why this was done on Signal and why these war plans were discussed on Signal. Signal is not, it's a commercial app, right?
Right.
You would think that war plans would be discussed in a more sensitive environment, in a more closed-off and sensitive environment. And it's a point of concern that a reporter, and I say this as a reporter, I have no business being on these text chains. I just don't. You know what I mean? And so it's a concern that a reporter was accidentally and inadvertently allowed onto the chain. Now, the question is, was this a one-off, or were there other instances in which this happened?
And are there leakers inside the White House? That was a problem. That was a problem before. And I I was asking myself the question today, if I got invited, because I have a lot of journalists and a lot of people in my phone that maybe I've had one conversation with, but I save the number when I have the conversation because you never know when you're going to need to talk to them again. And so I have a lot of people in my phone that I don't know that well, and I might not even remember their name unless they called me and reminded me when we talked. But this just seems crazy, and I would think if I got included in a list like that, I would probably call my source and go, I probably shouldn't be on this list. And are you aware of this, rather than listening in and seeing what you could get from it?
Well, and that's sort of the question that's going on in reporter circles right now, right? Which is, what would you have done if you were on this chain? Because, do you listen in? Do you not? I don't know how I would have handled it personally. That would have been a conversation that I would have to have with my bosses here at where I work, Axios. And that's a conversation that every reporter would have to have with their bosses. The Atlantic decided to take the approach they decided to take. And so that's a conversation that every reporter would have to have with their bosses as they determine how to print this stuff. And today I see the Atlantic has printed more details of the conversations. And so that's a decision the Atlantic decided to make.
Yeah, and I tell you, we've come a long way from the famous, cocktail parties that Kennedy would have with the major news anchors, and they'd swap all kinds of stories while they were having drinks, but you never saw them in the news. So.
Right.
It's come a long way from that. Well, Alex, I appreciate you being with us today, and I'm getting the book. I know I'm going to read it this weekend. We'll get back with you on that with all the stories, but I love the fact that you took the tact of that this story needs to be told, because it is a story that needs to be told, and we need to do more of this, actually telling a story. I don't deny that I have a bent. I'm a conservative. People know that I'm a conservative, but I have people tell me all the time, but I think you present things fairly. And that's what I try to do. I try to let people know what my bias is and then present it fairly. And then we can go from there.
And let people reach their own conclusions, right? Present the facts and let people reach their own conclusions. However they want to take it is fine,
Absolutely. So what are you working on now?
We got some more Trump stories in the works. It's a busy time, and looking towards maybe doing some stories about the midterm elections, which are coming up next year. And I'm sure you guys in Georgia have a lot of really important races down there, and we're all waiting to see if Brian Kemp runs.
It's like 10 years in every month. Of political stories. It's crazy. And for me, I'll just give you this. You can take it however you want it. Brian Kemp is the linchpin to this whole thing, because if he runs for Senate, then everything stays pretty stable up and down the line. I mean, we'll have contested primaries. We always do. But Republicans are pretty safe if Brian Kemp runs. If Brian Kemp does not run, it's going to be freaking fruit basket turnover for every constitutional seat on the Republican side. And it's going to give Democrats an opportunity to win some seats they haven't won in 20 years. And so there's a lot riding on Brian Kemp's decision here.
Oh, interesting.
Yeah.
And do you think that how do you think he stands with Trump right now? How do you see that playing out?
Oh, I think he's going to be fine with Trump. I think because he took the high road the whole time. I mean, and that really Trump wants to win that seat. If Brian Kemp runs, he is the nominee. Okay, there'll be some crazy people that run against him, but if he runs, he's the nominee, and he's going to work with Trump on that. I mean, Trump will work with him on it, I think.
Interesting.
We shall see, won't we? All right. Well, listen, thank you, Alex, so much for your time today. Alex Isenstadt, the book is Revenge, the Inside Story of Trump's Return to Power. Have a great day, Alex.
Thank you, Martha.
To hear the full versions of last week's Martha Zoller shows, go to the podcast page at accesswdun.com, and you can follow me on social media at Martha Zoller.